welcome to episode 36 of the Dental Realist podcast. I am Dr. Ryder Waldron, and I'm here as usual with Dr. Marcus D. Neff and Dr. Troy Stevens. Troy, how's it going tonight?
Doing really well. Glad to be podcasting again after a little time off.
Yeah, and I forgot to wish you guys a happy Dentist Day. That was March 6th. So
Yes, Sure would be nice if we got a whole freaking week like the assistants. But hey,
well,
you know.
I think
that's
hygienists
right.
get a week. If administration
They do.
get a week.
Yes.
We get a day.
Marcus, welcome to you tonight.
Thank you.
So, how did you guys celebrate your National Dentist Day yesterday? That was a new one to me. We've been doing this for almost 16 years, and I didn't know we had our own day. But did you guys do anything special to celebrate?
No.
Did you get a pat on the back or a good job, doctor, from your staff?
Attaboy.
Nope.
No, I don't remember that either.
Nope.
I got
not a one.
I got nothing. I didn't get a thank you for the job.
But I did
didn't
get the
anything.
assistants some nice cards, and we got them an ice
that was
cream
nice.
cake and enjoyed that. So
Wow.
For National
did
Dentist
not
Day,
do
you
that.
celebrated their stuff. Huh?
well, it's their week at the same time.
That's true. It overlaps.
It's true. Well, you're nice, Marcus.
Well, they
You're-
could
you're-
have thought they could have at least thank you for something.
That's right. Well, guys, we are now on Spotify. I guess we can tell all of our listeners that. So if anybody wants to listen to us on Spotify, have at it now.
Great.
So it's pretty
I
exciting.
like
that
Spotify.
streaming audio stuff that the kids are doing these days.
Yes.
Yes, it is, Grandpa.
Okay.
And another thing is we've had our two best months of downloads in February and already in March, and we're only about a week into March. So
Yeah, thank you.
to everybody that's been downloading.
Thank you very much. Yeah, kind of exploded actually. It's
Yeah.
it's kind of extremely. It's
like-
like exponential growth.
Yeah.
It's like a day.
I've only downloaded like 50,000 of them myself. I just keep download and delete, download, delete. But
You've got an on auto something. You've got like
I just
some
have it on
script.
auto download.
You wrote a script for it.
Yes. Well, guys, let's start. I'm going to read an email that we got from one of our listeners a couple weeks ago. And, since we follow HIPAA rules around here, we're not going to read this emailer's name, but we will just read the
They've
content
got
of the email.
black bars across their eyes right now. So.
Yes, so you won't recognize him in the picture. It says, I just wanted to say thank you. I am starting dental school in the fall, and I am so excited. I want to be a dentist more than anything. However, I have been scared and nervous about the hardships of dentistry because they're such an enigma. The death, the stress, and especially the difficulties of managing a practice. I have tried to educate myself to prepare for the stresses of dentistry without luck because, like you always say, nobody talks about it. Your podcast has been amazing for me. You are always worried about sounding too negative, but I don't think you are. No matter how much I listen to your podcast, my excitement for dentistry is still there because I know it's my passion. Your realism is necessary, though. Otherwise, I'd have been tossed into this career without any idea what I was getting myself into. I just want to say thank you. Now I can go through dental school and begin my career with the right mindset and some great advice. So that made me feel good, guys. How about you? Yeah.
That's the reason we do this.
It is.
Yeah, I thought that
Very
was pretty cool.
Yeah.
Very cool.
That was
that's
awesome.
awesome.
Thank you so much for those kind words.
Yeah. So tonight we're going to talk about some more, I guess, dental school topics. And Marcus has a pretty unique role with some dental students. Marcus, I'll let you tell the listeners, what your role is, what your title is, what you do. But I mean, is hero too strong of a word to describe what you do, Marcus?
Well, I don't like to brag, but I mean, yes, that's probably accurate. But
I mean, superhero.
I think I
don't
saw him in a Superman outfit, didn't we?
know. He wears spandex when he goes to the
I
school.
think we saw him. Yeah, we should actually post that somewhere and then put a link to it in the podcast.
Yes, that's not a bad idea.
And when he's
might
dressed up as
chase
a tooth
away
fairy.
I think
Yeah,
our
Marcus-
downloads would come down pretty quick.
Well, I don't know.
Decrease.
May increase.
I don't know.
You never know.
Maybe we should find out. So, anyway, Marcus, tell us about what you do with the dental students.
Sure. So I work at a community health center in Pocatello, Idaho, and so every year now for the last 4 or 5 years since I've been there, a dentist that I used to share space with when I was in private practice, he brings in some dental students He runs the Idaho Dental Education Program, or IDEP. It's a program for first-year dental students that Idaho has with Creighton University. So in Idaho, we don't have a dental school, so they've got this program where about 10 students each year apply, and they get selected, and then they get to do their first year of dental school in Idaho, and then they go do their last 3 years at Creighton University in Nebraska. So anyway, this colleague of mine, good friend of mine, he brings those students in and just has me share with them kind of my story, what I've done in dentistry, where I work now. And then we just have kind of like a little discussion. They can ask questions, and I do my best to try to give them answers. And so, yeah, they came in this last week, got to meet with the whole group of them, and it was, as usual, a pretty interesting and enjoyable conversation.
Cool. So, well, let's talk about some of the questions and concerns and things like that they have, and then Troy and I will see if we can help out these students. How does that sound?
Good. I like it.
So you've given us a list of some of these questions, but the first one is, why did you only work 2 days a week in your practice when you first started? So, Marcus, why don't you tell us why?
So I did a startup practice when I first got out of school, and the biggest reason was I just didn't have enough patients to patients, but patient with a T.
Yes,
with a T.
Yeah. Yeah, so I didn't have enough people coming in to see, and so really I could only fill up maybe a couple of days a week. So I had to go and work wherever I could. So I was traveling to 2 or 3 other offices and filling in a day here, a day there, just so I could make ends meet. Because when you do a startup practice, you pretty likely can't support yourself on just the startup practice. So
Yeah. Well, Troy, I want to ask you this next question. Why did dentists seem to only work 3 to 4 days a week? Because the three of us had some pretty rough weeks. So why don't you explain why dentists typically work 3 to 4 days a week?
Can I be straight out honest?
Yes, you can.
I mean, this is the dental
That's
realist
what we're here
show,
for.
right? It's because that's all we can tolerate. I mean, honestly, let's be real. Yeah. I mean, I think all of us started out. Well, Marcus, with exception him, because he started a startup. Well, you did a startup too, Ryder, in another guy's office.
Yeah, before I purchased. Yeah.
But you were always. I think you were working 5 days a week, though, right? Were you associating somewhere?
Me? No, I was probably like 2 or 3 days at my office, and then I did like a half a day at another office.
Okay.
And then when I bought my practice, I still did another day at a different office. So yeah, then it was probably like 3 or 4 days a week.
Okay. Yeah, I mean, I had a different situation where I came into an already established practice. So I started out the first 5 years of practice working 5 days a week, and I tell you, that's the only time you'll ever catch me working 5 days a week. You get so tired and just so, I mean, you're just so busy, and it just strains you, and you know, that's really the honest truth. I mean, you can only tolerate it for so long.
Yeah. You know, when I was shadowing before I went to dental school, I'd go watch this guy he was my dentist. I'd go to his practice and watch him work, and I know this sounds stupid now, but like I'd think, oh my gosh, this is about the easiest profession there is. I mean,
Yes.
you just like poke somebody with a needle, and then you drill a hole in their tooth and pack some stuff in there, and you send them off. I mean, how hard is it? It's easy, but it's pretty taxing.
Yeah.
Oh yeah.
It's more emotional, right? Wouldn't you guys say?
I would say that's definitely, like, physically, you know, our bodies are tired after, but the emotional and mental drain is probably the worst part of it, because we've talked before, like, we'll go home emotionally spent, and we're like zombies sometimes on, you know, Wednesday, Thursday night at the end of the week, and it's rough, and it's not like we're working in a coal mine or anything like that. Don't think that. We're not trying to get a ton of pity, but it is emotionally taxing sometimes.
Mm-hmm. Yeah.
Just about all the time.
Yeah, it is all the time for me. You just so many different personalities of the day, you know, when you talk to 30 people a day, and you know, you're just basically trying to care for them the best you can, and going from, you know, say for example a child, where you have to act like you're about 8 years old. And then you go to, a senior citizen where you're acting like you're all mature and knowledgeable and, to the person that doesn't care about what you tell them, and to the other person that wants to know every little nitty-ditty, detail of everything you're doing. And you just flip through those switches constantly all day long. And after, 4 days, you're ready for the weekend. That's for sure.
Yeah.
Yeah. Yeah. And, another thing that I've noticed is, when I first got into practice, when we first got out of school, I did some Saturdays. But what I found is I'd try to work from, 8 to noon on a Saturday or something like that. And most people would cancel. And so it got to be just kind of a waste of time. And I've noticed that on Fridays lately, too, that people say, how come you don't work Fridays? And, all these people say they have to come on Fridays. Well, then they schedule their appointments and half of them no-show or reschedule because they find better things to do. So it's not always real cost effective to be working on Fridays if you can get them to come, another day and not lose money on a Friday or a Saturday.
Yeah, and similar to that is, if you stretch your schedule over 5 days or even 6 days of the week, you may not be as busy on each of those days. Your schedule may be kind of spread out and sporadic. And is that cost effective, or would you be better off to condense everything down into 3 days or something like that?
Yeah.
And there's trade-offs to that too, because then there may be some people who they need a day other than Monday through Wednesday. They may need a Thursday or a Friday. But anyway, those are some considerations.
Yeah, one other thing it does have, is that it allows your staff, and this is true too. It allows your staff a time to schedule other appointments, so you hopefully have less staff missing throughout the week.
If you give them a day off and they can predict that they need to make their doctor's appointments on Fridays or something like that, then they aren't taking time off during the week, and that makes sense too.
Yep, exactly.
All right, well, Marcus, we've got another question from one of your students, and it is, what are your favorite procedures? Marcus, what are your favorite procedures?
Oh, when they asked me that, I was seriously like scanning my brain really quick, and I was like, do I have anything that I really like, or do I just make something up here?
What did you tell him though? Let's hear the truth.
So what I told him was CEREC, that I like doing CEREC crowns. And honestly, if I had to pick something that I do each day, it's probably a crown would be the thing that I would rather do than any other procedure. And then CEREC I've been doing for 6 or 7 years now, and the technology part of that is really cool. I mean, it's kind of fun. I enjoy technology, and so being able to get in there and design the crown, mill it, do all that stuff actually makes it a little more enjoyable to me than just like taking an impression and all that good stuff. So that's what I told him, and that's probably for me. That's probably it.
Yeah. Okay. Before I go to Troy, Marcus, what's your least favorite procedure?
That's a good question. It might be probably your root canal. Endo. I for whatever reason, I know there's people out there that just love endo and are great at it, but for me, it's like black magic. I don't know. I feel like I could.
It's voodoo.
I don't know. Yeah.
Yeah. Troy, what about you? What's your favorite and your least favorite?
I don't know. Over time, it seems like I've grown to like almost all procedures equally poorly.
Equally poorly.
Well, just the reality is, once you do something for so long, we're 16 years in now, and how many class 2s can you do before you just get really, really bored? And how many crown preps can you do before you get really, really bored? And I'm kind of sadly at that point in the career where nothing really excites me a whole lot. The procedure that I do, probably that I would prefer to do, is a crown prep. Just like Marcus, I don't have CEREC, I don't have that technology, but the reality is that I think it's a lot. I seem to get better predictable results with crowns than pretty much anything. But yeah, my least favorite would be probably a surgical extraction. I've gotten to a point where I just don't do them. I don't enjoy it, so I just don't do it.
Yeah, I would go with you guys on the probably crown and bridge stuff would be the the best thing to do. And I mean, besides the fact that it's probably one of the more productive procedures, it's also, like Troy said, one of the most predictable. I mean, you get better long-term results versus like a class 2 composite, which sometimes those, you never know what you're going to get. And crown and bridge, there's not so many steps that make it tedious. I mean, when you're doing like a quadrant of composites, man, those suckers get kind of tedious to put the band on, bond everything, cure it, flowable, cure it, composite, cure. I don't know. That gets a little tedious to me, but I think my least favorite is probably extractions. I think I've learned now what I can do and what I can't do. And, everybody says that, pulling teeth, they act like that's the easy thing to do. But, man, there's nothing worse than getting in and trying to extract like a lower molar and you hear that snap. And you just know, crap.
It's going to be a long day.
It's going to be a long one. And, I mean, those oral surgeons will have those things out in like 10 minutes, but it's a little more of a chore for us who don't do them very often. So, yeah, I think oral surgery in general is probably my least favorite.
Yep. So. You can ask any dentist, and you're going to get differing opinions on all of that. I mean, it's pretty subjective.
And I think that's important. I kind of remember now when I was talking to him, I told him, really try to pay attention to the things you kind of enjoy in dental school. I mean, I think in dental school it's a really good time to try everything and kind of put yourself out there a little bit and see what you might be good at, what you kind of enjoy. Even though you might be a little nervous and scared about trying stuff, but also pay attention to what you really enjoy and see if that's something you're able to do when you get out and practice. Focus a little more on it. Might be tough, might be the reality of it. You might not be able to just focus on one or two things, but
yeah, I think that's good advice, because I think that's something I wish I had done more in dental school, is tried things more, or ask the actual practicing dentists who were part-time there, like, things about everyday dentistry, and, maybe done some more molar endo, or, tried some tougher extractions when you have the oral surgeon to fall back on. But, I think that's good advice, to try everything. But then you're stuck doing so much book work and all that stuff. It's tough to want to stay late or, take extra time to do that stuff when you could go home, get done early or whatever.
Well, you don't like staying late?
Well, I mean,
really? Honestly,
I'm going to go into the office. It's 7:45 here right now. I think I'll go in and do some more work tonight.
I just want to go type up some chart notes. I mean, just if
that sounds like a good time too.
We don't want to be real.
Well, you're a liar. Well, so Marcus, you might be the only one that can really answer this next question, but it's about your Army loan repayment. You joined the Army after dental school, not before, and it's helped to repay most of your student loans, from what I understand. But why don't you tell us a little bit about that?
Yeah, I think that seems to be a popular one every year when I meet with these students, is when I tell them that I joined the Army. It's been almost 6-7 years now.
You were like 60 at the time, right? Is that?
Yeah, right, exactly. No. I had to get an age waiver, but
Yes.
When they saw my physique and they knew what I could do to the enemy, they let me in.
Everybody fears you.
Yes, that's right.
Yes.
Yes. No. So, obviously these dental students know they're going to come out with some debt, and probably a pretty substantial amount. Some of them, I think, look at it and kind of like I probably did when I was in school and just think, whatever, it's going to be a bunch of debt, but I'm going to be a rich dentist. I'm going to make a bunch of money, so I don't really care. But some of them are, and I think more and more of them are genuinely interested, because the size of student loans that people are coming out with now is crazy, even compared to what we were,
Yeah.
So I think it's a pretty interesting topic for them. So anyway, I joined the Army Reserve about 6 years ago to get student loan repayment. Basically, what they offer is about $250,000 in student loan repayment in exchange for, turns out to be about an 8-year commitment, but they'll pay it out over 6 years. So that can make a pretty nice dent, if not get rid of your student loans, depending on how much you have. So I think the students are pretty interested in knowing, well, how does that work? Like, what do you have to do? And if you join while you're in school and you do it for the 4 years, basically you're going to owe the Army 4 years when you get out. You're going to be active duty. You're going to go wherever they tell you to go, and you're going to be a dentist for the Army.
Gotcha.
You're going to basically do dentistry. But if you do it that way, active duty, you're going to not have any debt when you're done. You won't have any student loans when you're done.
That is a good way to go.
That's nice. Yeah.
Looking back, that's a fantastic way to go.
Yeah.
Yeah,
definitely.
When I was in school, I remember the recruiters coming around, and I kind of gave it a little thought. But at the time, I thought, "Oh my gosh, the last thing I want to do when I get out of school is be stuck in some crazy place wherever they send me and doing dentistry." But in hindsight, you look back on it and you're like, 4 years, that would have been a drop in the bucket to not have any of those student loans at all.
Yeah, that's true. And, our student loans, this might seem small compared to what dentists or dental students have in debt now, but ours was about $200,000. And I think over the 30-year repayment, we'll end up paying about $350,000. So,
yeah, and we locked in really low rates too.
Yeah,
yes.
We got low interest rates. Yeah. So, if you come out... Yeah. Oh, go ahead.
But doing it the way I did, I waited until I'd been out and in practice for like 10 years or something like that.
Yeah.
It still ends up being a pretty good deal, but my commitment's a lot longer. I'm not active duty, so there's that. But typically, if you do the reserves, you're going to have 1 weekend a month, the 2 weeks out of the year that you kind of hear about. Mm-hmm. It's... You when you go, you have to put on your uniform but you basically do dentistry.
Do you wear your uniform when you do dentistry, or do they have other kind of clothing that you have to wear?
Usually, wherever you go, they have scrubs that they'll have you change into. So
the camel scrubs.
Sometimes.
Really?
Sometimes.
Really?
That can get tricky because people can't see you coming.
Exactly.
Yeah, man, you just look like a head coming at them.
Yeah.
That's creepy.
Sneak up on them, and all of a sudden you're
a head with a mask and glasses on.
Man, you're like a ninja in the dental office.
And my wife likes me to put on the uniform now and then.
Yeah, well, that's what she says. Wow. Well, yeah, that's interesting because I was wondering if you gave 4 years to the Army, if they did cover all of your student loans, all of your tuition. So that might be a good way to go nowadays to help pay for. I mean, you'll save a ton of money. I don't know.
The other
what
thing
the interest rates
that's a big savings is the interest or the insurance. I mean, like to get insurance when you're in the Army Reserve is dirt cheap compared to what you'd pay privately.
You mean the Affordable Care Act?
Yes, the Unaffordable Care Act.
The Unaffordable Care Act, yes.
Yeah, Troy and I afford that every month.
Yes, I afford it. $1,500 I afford it.
I mean, really, Troy and I probably combined pay more in a month than Marcus pays for insurance for a year. I mean, realistically, it's pretty close.
Yeah, right now for my family, I think it's about $225 a month.
Yeah, so
and I have 13 kids.
Yeah,
25.
I only have.
So
I
have 2 kids. I'm paying $1,500.
Yeah, $2,800 a year, and I pay about $1,000, $1,100, something like that. So Troy and I are paying, probably about as much in 1 month as you would pay in a year. The total between the two
it's
of us,
really, really good insurance. And there's also other benefits. I mean, you have. I mean, if you want to do it, they have kind of a smaller retirement benefit you can pay into. There's just lots of little benefits like that. But there are sacrifices. I mean, I haven't been asked to do anything too crazy, but you could get deployed. I mean, so there's things that you have to consider, and you have to accept those responsibilities. You can't just be doing it and say, I changed my mind. I want out now. You can't.
Yeah, the Army doesn't
just let you walk away.
That.
Do you have to go to a specific facility? Do you have to go to a VA hospital?
So when I do my 2 weeks, they send out a list usually around January of about half a dozen or maybe a few more locations, and they're bigger military bases usually in the southern part of the United States where they do a lot of training. And so when I go, It's usually in the early summer, and it's when they have a lot of new guys just got out of basic training that are going to do their whatever job-specific training before they go off and get deployed or go to their permanent duty station. And so they want all of their dental treatment to be done when they get shipped out.
Oh, I meant like your family for medical care.
No.
Do you can you just go to your local doctor? You don't have to have a specific position. You don't have to go to a VA or anything.
You don't have to go to a government facility or a military facility. It's, wherever you would want to go. Co-pays are usually around $30. It's
just similar to everybody else's stuff.
Yeah.
Nice. Cool.
Low deductible.
Yeah. That saves you a lot of coin.
It does. So
yeah.
It may not be for everybody, and believe me, there's times when I think I just want to be done and not have to even think about it, But at the same time, the benefits are really, really good.
Yeah, and when you're done, you won't be paying a student loan payment every month like Troy and I are. So
yeah.
So that's awesome. Yep. Yeah. We thank you for your service, Marcus.
Absolutely.
Well,
Captain,
thank you, Major.
Oh, you're a major. I
Major.
Major.
Yes. Major something.
Yes, my wife always says that. She must be a major pain in the.
You know what?
Yeah. Well, another question they asked you, Marcus, was what do you look for or what to ask when you're looking at buying a practice or buying in as a partner? So, Troy, you bought in as a partner. Yep. And so, Marcus, what was your answer when they asked you that?
Well, my answer was, I've never bought a practice and anything like that, but I just told him, I would think you'd want to ask lots and lots of questions. I did merge with the practice, and I did that kind of hastily and just assuming the best, and I learned from that mistake that you really need to ask questions and ask lots of questions and don't feel like any questions are off limits. You need to really get details. That was my advice.
Yeah, Troy, what did you do when you were first, before you bought into the practice?
I associated for a year, and then I bought in after that, after I kind of knew what I was getting into, and I knew all the numbers and, kind of knew production. I knew, all that fun stuff, the overall health of the practice, which helped, which was nice. Heard of, stories where someone... The one thing I would caution folks about is if you're going into a position where an older guy is trying to sell his practice and he wants you to come and work for him or come and, to buy in, be very cautious. We find, and Marcus found this out, Marcus could maybe speak more, is that these folks that have been, and you too, Ryder, actually, these folks that have been practicing for 30 and 40 years, 50, 70, 80 years, because dentists have to play, we have to work that long anymore, have a hard time giving up patients. They have a hard time giving up procedures to the new guy. And I know, Marcus, you found that out when you merged with that one practice, and I've heard many, many stories of that where, they go in, they won't let you do anything. We had a guy that we know that, went in with his father, and his father didn't have any faith in his son, and ended up, going to another practice, said, I'm not even going to practice with my dad anymore. So you got to kind of be careful of that. I went into a position where they were already in a partnership. They were very familiar with the patients seeing other doctors, and so it was not an issue at all.
Yeah, I've heard of, and mostly just read about, a lot of associateships that fall apart. Either the associate went into it, not knowing what kind of procedures he would be doing, how much he would be getting paid, and the owner doctor expecting more from the associate. I see a lot of owner doctors looking for associates that are good at taking out third molars and doing wisdom or doing molar endo. Well, when you're right out of dental school, how are you good at either of those things? But they want them because they don't want to refer stuff out and keep more in the practice, but they don't want to do it themselves. So, I wouldn't have. I would have been way over my head if I got into an associateship like that right out of school.
Yeah.
And I don't know. I was thinking of things like, if you're buying the practice right, straight out, like, what's the accounts receivable look like? What are the payment arrangements with patients? If you get people coming in and they're getting a crown done, but they want to make a $50 payment for 6 months, well, is that really what you want? Or, do you prefer that people pay at the time of service like they should, because there is the, point of diminishing returns if you're just collecting this $50 every month. But, staff, is the staff going to be loyal to you after? Because I've heard of some that the associate dentist doesn't feel like they have any authority over the staff, and the staff only listens to the owner dentist. And, there a lot of messy breakups in things like that, I guess.
Or when the guy comes in and buys the old guy out, and the staff doesn't like the new guy, and they all leave.
Yeah, and that's tough too.
Happens.
Yeah,
that happens.
Yeah, and I guess I kind of had a situation like that, because the front office lady that was working for my father-in-law, who I bought the practice from, she didn't want to update to any, computer software. She was paying a company. Well, she wasn't. My father-in-law was paying a company to send out the bills for him. And when I did like an analysis of it, he was paying like $6 a bill to go out. That is ridiculous. And, I told her we're going to update to, using some computer scheduling, and she's going to do the billing, and she just didn't want to do it. She gave me an ultimatum that she could either go back to her paper book where she just wrote down the appointments, or she was going to have to leave. And so I graciously let her leave. And, things really picked up. But it was, you can get into things like that. So, talking to the staff, getting their ideas on things, seeing what they like and don't like, and, before you actually buy a practice like that.
Yep.
Yeah, and I think you can, if you're just getting out of school or you're getting close to getting out of school, you can feel that pressure to, man, I gotta make a decision. I better just do this. I don't want to ask too many questions, but I think you just gotta really, really be honest, really ask lots of questions, really figure out if it makes sense.
Yeah, and I wonder if it would be good to, work at 3 or 4 different offices at first as an associate, 1 day a week or 2 days a week or something, to see different practice philosophies, see how things run, and kind of get an idea of what you want to do with your practice when you are the boss. If you ever want to be the boss, a lot of people just want to be an employee and don't be the boss, and there's nothing wrong with that. Sometimes there's a lot right with that.
Yeah.
Sometimes it's the better option to do it that way.
A lot less headache.
Yeah.
Let somebody else pay for your 401k.
Yep.
All right. The next question is, what procedures keep you up at night? But also, let's just generalize it and say, what in dentistry keeps you guys up at night? Because we've kind of already talked about our least favorite procedures. But Marcus, what keeps you up at night with dentistry?
It's kind of interesting, because when I was in private practice, it was more than just the dentistry that would keep me up at night, typically. Just because there's all those other things that you have to take care of. If you own the practice, you're the marketer, you're the human resources person, you just have all those responsibilities. And so some of those things would weigh on me, but just generally speaking, as far as dentistry, I think what sometimes keeps me up at night is just stressing about, a certain patient or a certain procedure that I did that day. A patient that was high maintenance, did everything go right? Could have I done this right? If I did this a little different, would have it worked out better? Is that going to last? Some of those things we work in a profession where we're expected to be super precise, near perfect, and the reality is hardly anything ever is, and it's just totally it can be stressful to and it's hard to just leave that behind and just go on to the next day and forget about it.
It's true. Troy, what keeps you up at night?
The same exact thing that Marcus said. Just the stresses of keeping staff happy and making sure you're staffed or you're not overstaffed, and dealing with all the pressures of owning and running a business, and making sure all your patients are happy and they're not upset, and doing everything you can to have them have the best experience possible. I wouldn't say that keeps me up every night, but there are times that, something happens during a day and it just eats at you, somebody got disgruntled and you didn't see that it should, and you're just like, man, I wish they would be a little bit more lenient and realize that, even though we have done this for years, sometimes the front desk says something to somebody and you're just like, oh my goodness. And, the reality is, maybe she was having a bad day or whatever, but, then you end up paying the price for it, because everything in the office, everything that happens is a reflection of the doctor. That's it.
Yep.
They'll leave a practice if they're mad at the front desk. They could love the doctor, but if the front desk or the hygienist or the assistant upset them, they'll leave. And so that's the thing that stresses me out is, making sure my staff is saying the things that are right and treating people good, and it wears on you, and it really gets you thinking sometimes in the middle of the night.
Mm-hmm. It sure does. Yeah, absolutely. I think dealing with the people is probably the thing that worries me. You got to keep your staff happy, make sure that they're all getting along, and you worry what they think of you if you're doing the right stuff and doing it the right way, or patients, are they happy? Did I say the wrong thing to them? And then looking ahead at the schedule sometimes is a huge mistake, because you see so and so coming in and you think, oh my gosh, I really hate working on that person, or it's on the schedule that they're having an issue with something. I had on my schedule this week, I just saw a patient lower denture issue. I'm thinking, oh crap, and all it was she needed an adjustment. So, which was no big deal. She left perfectly happy. But you see those things on the schedule, and it just, your mind starts racing about, well, at least mine does, what could possibly go wrong, and in my mind, that's everything. So,
and your mind is correct.
My mind is usually correct. That's right.
It's amazing how many things can go wrong.
I'm never wrong about anything.
I think we're programmed that way, just in dentistry in general. It's like we learn to be so darn analytical and how to try to avoid failure at all costs, and then we see that there are things that are just going to fail. I mean, because we cannot maintain home care. I mean, there's people that I swear don't brush between their 6-month visits,
Yeah.
And you're just like, how can people expect it to last if they aren't taking good care of it? But they do. And of course, if it fails, then okay, doctor, you put this filling in 2 years ago and it's already got a cavity in it. Did you not get the cavity? Well, it looks like you haven't brushed in like 6 months, Yeah. But you can't say that, because then they're walking down the road to the next office, and it's just, that's the head. It's like a head game that everybody plays, it seems.
It's true, and we have, and I don't know if it's just how we are or if it's learned through dentistry, but we're like trying to be perfectionists, and it's nearly impossible to do a perfect restoration in a mouth that's wet when the products you use, the materials, have to be dry, and it's it's basically a recipe for disaster. And anything that we do get to be successful should be celebrated, but it's tough, and people do expect, I think we see patients and think that they expect precision and perfection, and then we project that to ourselves, or I don't know, internalize that, and so we have a hard time when a filling fails. I mean, we could have 19 out of 20 of them be successful, but that one is the one that eats at us all the time.
Yeah, for sure.
And I think it's important to minimize your stress by, I mean, it's a tough balance, because you want to push yourself to do things that and do bigger procedures and all that kind of stuff, but you also want to minimize your stress by not taking on things that you're probably not very good at, and you're not going to do them very well. Like,
that's a good
if you're
point.
really not good at, if you really didn't have a lot of experience in molar endo, and you're just trying to do it all the time, and it never turns out well, and patients always have to have retreats. I mean, it's going to be stressful. Decide, am I going to just not do those, or am I going to get better at them and take the education and training, whatever you need to do to get better at them.
Yeah, that's a good point. And sometimes you could spend 3 or 4 hours in multiple appointments on a molar endo when you could have referred that out and done, use that time for something else. So, and the headache is not worth it.
Yeah.
Not even.
Yeah, that's a good point.
That's the thing you find out as you practice longer. You find out what for one thing, what you what you enjoy, what you're good at, because not everybody is good at everything, There are certain people that are good at certain things, and you have to accept that you're not good at something, and sometimes that's hard to swallow, but it's the reality. And if you push yourself into the realm of doing things you're not good at, you're going to cause all sorts of frustration to yourself. It's better to focus on the things that you're good at and get really good at them than to try and make yourself somewhat mediocre at other things that other people are good at, That's why, like I say, with surgical extractions, I don't enjoy them. I don't do them. I just send them to the surgeon. The patient has a better outcome. The surgeon does it so fast and painless, and it's great. And I don't stress out about it.
Yeah.
Yeah, and that's a great point. And hopefully some listeners will, take that to heart, because it really sucks when you have to refer out a molar endo and the patient will look at you like, oh, you can't do that, or you don't do that, and almost makes you feel like you're an inferior dentist. And I don't know, I struggle with stuff like that, and then I go home and think, oh, do they think I don't know what I'm doing? But if you can just refer those people out and get them out of the office and get the root canal done somewhere else, or the surgical extraction or whatever, man, it just makes your life so much easier. And those people that complain are just, you're going to get people that complain, and you're not going to make them happy no matter what you do. They would be the first ones to complain if that root canal failed. So,
or you can't find a canal, and
Yep. So, whatever. Well, guys, speaking of specialty items, did you guys ever think about specializing when you were in dental school? Either one of you?
1 week.
Yeah, it did. I think heading in, I thought I wanted to be an orthodontist, but it didn't last very long.
I thought about being an oral surgeon. When I did my oral surgery rotation, I pulling those making those wisdom extraction those wisdom teeth. I thought that was fantastic.
Yeah.
And looking back now, it's the best decision I've ever made to never ever even think and contemplate about doing that ever.
Yeah.
I would have been totally miserable.
It was amazing when we did those on the rotations, and those suckers seemed to just pop right out because you had that oral surgeon standing behind you, or down the hall. Like, well, if I can't get it out, he'll get it out. I remember pulling, extracting. I think it was like 4 or 5 or something like that, and one of our dental school friends was assisting me, and I could not get that thing moving. And he was like calling me names in my ear over the patient, and I'm thinking, this is ridiculous. What am I doing? And so, I don't remember having any aspirations to specialize. I wanted, I'm a super patient person, so I wanted to get in school and get out and start making some money. Yeah. And that's how I felt.
Part of it for me was, I quickly realized that, I knew going in that to be like an orthodontist, you had to be one of the top students in your class. And I quickly realized that was not going to happen for me. I didn't want to work that hard to get that far, to have those kind of grades, and I'm just not one of those people that can just. I swear we had classmates that could party and stay out late, and they would pull A's out of thin air, and me, I could spend the whole night at the library, and the next day I'd maybe be lucky to get a B on a test.
I remember one night I think it was you and I, Marcus, were studying. I don't know where Troy was. He might have left us. We were studying for some pedo exam, and I swear I think we went to Taco Bell in the ghetto at one point. Our lives were in danger, I swear after like 4 hours of studying, I still didn't know the difference between like a pulpotomy and when to do it, and between a pulpotomy and like a pulp debridement and all. Good heavens, I don't know.
Yeah.
So I'm right there with you.
You sure you didn't want to ever be a pedodontist, right? I thought for sure you liked that papoose board.
Yeah.
No, you guys know my story that the first time we got into clinic, I was on the pedo rotation, and so my first fillings were on a 2.5-year-old, and boy, that was a nightmare.
Oh my gosh!
I think I still have PTSD from that, and
wow.
It was let's see, I think it was a DO on L and a pulpotomy and stainless steel crown on K. I'm like, what the heck am I?
How can we be expected as a student to do that? I wouldn't do it now.
the kid in the quiet room, like, yeah, no papoose. But I'm thinking, what did I do to? And I remember people asking me after that. You know, I must have got around the dental school because people heard. But oh man, it was well, you guys have heard. You know, the assistant was yelling in my ear, "Be the dentist, be the dentist, or be the doctor, be the doctor, be the doctor." Like, my gosh, no! I just want to go cry. I want to cry like this poor little kid is crying right now.
Yeah, for sure.
So, that's why they had you in a quiet room, so no one would hear you crying.
Yeah. Nobody would hear me crying.
That's why they had that padded room in the back, right? Put the kids back there. They scream, and you can't. Nobody can hear.
Oh my gosh. So yeah,
that's true.
Awesome.
Yeah, it's like Nate. You know, we have a classmate that's a pedodontist, and he goes, I love being a pedodontist because all my fillings fall out.
Yeah.
Because all of my feelings are going to fail. They're all going to fall out.
Oh, that's so true. That's a good way to look at it. Well, Marcus, this is one last question they asked you. Do you like, or did you like practicing with another? Do you like practicing with another dentist, or did you like solo practice better?
Yeah. So where I'm at now, there's another dentist that works there with me, and honestly, I kind of like working with somebody else. I really didn't think that was for me. That's part of the reason I went into a startup practice, because I was like, I don't want to buy in and have to deal with what somebody else likes and doing it their way. I just want to do it my way. And, honestly, it's kind of nice to have somebody else there that you can just, talk to about what's going on, or ask a question, see what their perspective is on a procedure or whatever. And the guy that I work with is a good guy, and I'd consider us good friends, but we're not like hanging out after work. We live in different towns anyway, but
you're not doing a podcast with him.
That's right. I'm doing the podcast with guys in other places. But it's just nice it's just kind of nice, I found, to have somebody else there to just share your misery.
Yeah, well there are times that I work by myself, and there are times that I'll ask you guys about X-rays and what do you see on this sometimes, and so yeah, I could see that would be nice to have somebody to bounce some ideas off of. Troy, I guess Troy, you've never really worked solo before, but
never worked solo.
You enjoy having a partner to talk to throughout the day.
Yeah, I do. It's just like Marcus said. It's nice to be able to talk to somebody else and get a confirmation of what you're doing is the right thing, and that kind of thing. I think we've talked a little bit on another podcast. There's some other advantages of when you leave town, the practice is still open, you're still working. So there's that advantage, because I'll cover for him when he leaves, and he'll cover for me. All that stuff. So that's kind of nice.
Yeah.
So there are advantages. Really There's disadvantages too. If you don't get along with the guy, it would be absolute misery.
Yeah. That'd be terrible.
It would be absolutely horrible, and it would not last. One of you would have to move on. But
yeah, how does it work if you guys had I don't know, a business decision to make? Do you both have to agree to go for, like, if even buying a big piece of equipment or something, you both have to sign off on it, or
anything over $500, we both have to sign off on.
Gotcha.
Yep. But to be honest with you, we've never. I mean, I've been his partner, 15 years we've been in business together, so it's never been an issue for us, but I have heard of horror stories, of where someone's drawn a tape in half a line down a hallway and saying, this is your half and this is my half. And you don't touch my stuff and I won't touch yours. And so that's a brutal thing that kind of happens. So I've been lucky.
Yeah, that's pretty unique, because I've heard of other situations that don't end that, or that don't work out that well, and that would be an awkward office situation. I mean, it's tough when one of the staff members is in a bad mood. It kind of permeates throughout the whole office. But man, if you guys hated each other all the time, that would really suck.
Oh, that would be terrible. Yeah. It wouldn't work well. But yeah, I mean, I enjoy it. I really like the fact that when I'm gone, there's still someone at the office. That there's still production going on.
Yeah, I think that's great, because when I go out of town, I've got another dentist around town that I'll, ask if I can kind of send emergencies there if they can't wait. But otherwise, it's just, me calling them in something, or, I have, somebody there answering phones. But yeah, if they have a a real emergency, I've got to refer him somewhere else, and that kind of stinks. But that's how it is. That's why I never take weeks off.
Yeah, that's why you love it, though. I mean,
that's why I work 7 days a week.
You don't have a problem working all the time.
No, I don't have a partner to talk to during the day.
Well, other than the group text, we're always in. We'd always.
Yeah, that's right.
Well, it's been more like a 2-man text this week because Marcus has been so busy. He's kind of. I thought we got replaced.
Yeah, I thought he was out of town or something. I thought he was out of cell service.
I thought he might be dead. I don't know. I tried to see if if his wife was okay, but yeah.
Yeah, he was knee deep in composite.
Knuckle deep.
That's right. Well, guys, do you have any more words of wisdom to add tonight before we close up shop?
Those are some great questions that those students had, because those are some really, really important topics to know and understand before you get out. And for those people who aren't in dental school yet, it's very good to know. And that's why that email was so good to hear about, because that's exactly why we started the podcast, is not to drive people away from dentistry, but to set expectations appropriately so that you're not thinking that this is all bees knees, everything's hunky-dory. There's real things that go on that are real stresses and real challenges. It's not, it's got its ups, it's got its downs, and we just talk openly about it.
Yep.
Well said. Well, Marcus, do you want to tell everybody where they can like us and love us?
Spotify.
And find more of us? Spotify, yes.
That's right. We're on Spotify. I don't know how to find us there other than look for Dental Realist on Spotify.
Just go to podcasts and search for Dental Realist. I did it the other day. We're there.
Nice.
Very nice. You can find our podcast, of course, on iTunes and Libsyn and pretty much anywhere where fine podcasts are found.
Yeah.
We do also have a couple of books. So You Want to Be a Dentist is one of our best-selling books, and also So Now You're a Dentist, both full of great information, stuff that can really make a difference in your career. You can reach us at dentalrealist@gmail.com. So send us your questions, any feedback you have for the podcast. We're also on Facebook, Instagram, not Instagram. What am I wanting to say there?
Twitter.
Twitter?
Twitter's the Twitter. We're on the Twitter.
You can send tweets.
I don't know what you do there, but
yeah, you tweet stuff.
Tweet.
Yes, we're on Twitter. Anyway, we love to hear from our listeners. We appreciate all of your support, and we love doing this, and we really do enjoy getting to do this and talk to each other and share things with you guys.
Yeah, you bet.
Yep.
Well, thanks, guys, for joining me tonight for this podcast.
Yeah,
it was amazing.
Thanks for inviting me.
Yeah, you bet. I invited you on Skype. You're welcome. Yeah, this has been episode 36 of the Dental Realist podcast, and we will see you for episode 37 next time. Thanks.